Good afternoon, Governor, Lieutenant Governor, Melissa Jocelyn. Thank you for joining us. Everyone, as the Governor indicated, our plan for the first round of vaccine shipments maximizes life-saving care for our most vulnerable residents and protects our healthcare workers, performing COVID-facing work duties so that our healthcare system can continue to respond to our healthcare needs. In the coming weeks, our vaccine plan will continue to be refined based on the anticipated federal authorizations and the cadence of shipments from manufacturers. Based on the federal guidance to date, we've been told to anticipate, as you've heard from the Governor, 300,000 initial first doses, 180,000 of Pfizer, and 120,000 of Moderna, pending authorization, of course. Some of the first wave will also be allocated to the Federal Partnership for Long-Term Care Facilities that will begin on or around December 28th. There have been questions on the shipping process for the vaccine in the last few days. To clarify, the Department of Public Health places vaccine orders with the federal government on behalf of our providers. From there, the vaccine is shipped to the hospital facility directly from the manufacturer. In other words, the state does the planning, places the order, and the federal government activates the manufacturing shipping authorization for the provider. There's also been, as you heard, questions about how hospitals are approaching vaccinations for the staff. Hospitals and other healthcare facilities know their employees and their systems and situations best and are responsible for determining which healthcare personnel in what cadence in their facilities are vaccinated. In the coming months, there will be enough COVID-19 vaccine to vaccinate all healthcare personnel. Every facility had to attest that they will administer the program consistent with the plan that was accepted by the Governor and by the federal government. At this time, it is COVID-facing direct care employees, including direct support work such as dietary environmental staff, as example. It was recommended and has been recommended that the vaccination process occur staggered over a number of days in the event of any potential side effects and to ensure that you get the maximum number of staff. Over the next 2 weeks, 110,000 of the 120,000 doses of the Moderna vaccine are expected to be shipped, pending FDA approval of their emergency use authorization. The doses, as the Governor said, go to hospitals, community health centers, and other large ambulatory care providers and practices. 10,000 are being held to count for provider enrollments, new enrollments coming in, or other necessary provider adjustments. Additionally, CVS and Walgreens, which we're grateful for, begin vaccinating staff and residents in nursing homes the week on or about December 28th under the CDC's Long-Term Care Pharmacy Partnership Program. Their doses, as I said, come from the state's Pfizer allocation, so between 40 to 60,000 will be shipped to CVS and Walgreens for our Massachusetts skilled nursing facilities. That's 379 facilities. This vaccine process, much like COVID-19 in general, is fast-moving, ever-changing, and we will continue to calibrate our plans. We will provide updates on a regular basis. Yesterday, I hosted a provider call with the Department of Public Health where more than 2,700 individuals participated regarding the vaccine rollout. The feedback helps because it helps us target our questions into very specific FAQs. For regular updates, please visit mass.gov/COVID vaccine to learn more about the distribution timeline and when you can expect to have access to the vaccine. Individuals with questions about what phase they can be vaccinated, where does their particular position fit, can send an email to COVID-19-vaccine-plan-ma@mass.gov for prioritization clarifications. Obviously, there's a lot of questions because when we put the plan out, it's sort of in large tranches. So we've provided a specific email address for folks to say, where does this type of position fit? And twice a week, we will update the website to clarify where positions fit for prioritization. Shifting gears, this Thursday, 4.5 million Massachusetts residents will receive a message via the Everbridge Resident Connection Alert System. Public Health Commissioner Monica Burrell will remind all of us of the increased risk of contracting and spreading COVID-19 over the holiday season. The message will be sent in Spanish and English. Residents can choose to receive future messages by text, email, or phone in their preferred language by opting in at mass.gov COVID alerts. As Governor Baker indicated, our case and hospitalization numbers continue to increase, a troubling trend. Hospitals are balancing the needs of all of their patients, postponing elective surgeries in order to ensure capacity to meet their patients' full health care needs, COVID and non-COVID related acute illnesses. So, to all of us, as we plan for the holidays, it is important, essential, to understand that we're still very much in this second surge. And because of this, holidays need to look different. There are measures you can take to protect yourself and your loved ones from COVID this holiday season. Postpone or cancel travel this holiday. If you do travel, please ensure you comply with the mass travel order requirements. Limit in-person gatherings to, as you heard the governor say, to only the people you live with, your tightest bubble. Keep it small. Host a virtual holiday dinner with extended family and friends. It is important to remember, any time you gather with others, you increase the risk of contracting or spreading COVID. You are not only risking your own health and others if you host or participate in any in-person festivities. If you or anyone in your household has been diagnosed with COVID-19 and has not completed the isolation period, has symptoms similar to COVID, is waiting for a COVID-19 test result, may have been exposed to someone with COVID-19 in the last 10 days, or is at increased risk of severe illness from COVID-19, such as older adults or those with certain medical conditions. So instead of the traditional holiday dinner party, prepare foods for family and neighbors and deliver them. Virtually attend your traditional holiday activities, such as a visit with Santa or whatever that may be. Consider virtual caroling or reciting. Provide a link to your virtual caroling to the people you want to sing to. View holiday lights from your car. And when shopping for the holidays, consider lower risk options, such as shopping online, shop local, of course, or if you choose to shop in person, wear your face covering and keep your distance from others. And please remember to keep the basic preventive measures, which you've heard so often from us, to wear a face covering and mask, wash your hands, keep your distance, avoid groups. As the governor said, this is a one-time event. It is this holiday season, and if we all do this well, we will have much joy and celebration next year. Please follow the DPH guidance to help stop the spread of COVID-19 in our communities. For more information on holiday guidance, visit mass.gov/holidays. Before you venture off on your holiday plans, please remember, actions have consequences. Thank you.